Customers don't care about AI. Some do, most don't. Customers want that a really experienced doctor looks very carefully at their data and tells them if there's something wrong, and if so, what they need to do. And if nothing's wrong, many cases, how can I optimize? How can I go even longer, better? And that's the core insight I always need to explain first.
All right. Welcome to Be Well. Today we're joined by Nick Lenten, the CEO and founder of HealthTech, a Zurich-based preventative health platform combining full-body MRI scans, deep blood panels, and AI-driven analysis to detect over 500 potential health risks before symptoms arise. Nick brings a unique background, scaling consumer brands like Coolblue and Google products into the health tech space. And Ahead is currently live in Zurich, but also in other cities in Switzerland. Nick, it's really great having you here today. And I'm very curious to learn more about Ahead Health and you personally. But maybe before we talk about Ahead, I'll be curious to learn a bit more about your personal background. Would you like to introduce yourself briefly?
Of course. Yeah. Thanks so much for the opportunity. I'm Nick. I've been building consumer technology products for most of my life. Originally started doing that when MP3 players were still cool. So that dates me a bit, I think. Then I joined my largest advertiser. He was 23. I was 14. And I spent 16 years building it into the largest consumer electronics retailer in the Netherlands and Belgium. That's Coolblue, which is for Swiss people, I guess, the Galaxus of the Netherlands. For German people, somewhat of a modern media market. We are the most customer-obsessed brand of those two countries. Kind of a big thing there, not very well known outside of it. 3 billion in revenue, now 8,000 people. I was CTO and CPO there. After an exit, I felt it was time for a change. And then I, through a detour, ended up here in Zurich, joining Google, first to build out their European marketplace, and then later leading Google Flights, working with large engineering teams to build out interesting and many sort of AI-driven features, from price intelligence to helping build a buy button for French retailers in the European Google shopping product. It was super exciting, but I got a bit bored of the pace and the bureaucracy, so I quit my job and then went into HealthTech. And I guess more on that later. Apart from that, I'm a dad of 2 kids, a 5-year-old and a baby, and I live here very nicely. Never going back to the Netherlands because there are mountains here and you don't have many of those in my home country.
Great. Yeah, you mentioned you're based in Switzerland. We all love Switzerland, right? I'm also right now based here. Great introduction, Nick. You mentioned it. You have had some experience building actually consumer brands in the past. I mean, as you mentioned, you were part of Coolblue. You were actually the first employee. And how have your experiences actually shaped your vision and approach for Ahead, actually? How did it impact your current journey?
Coolblue, I think mostly customer obsession. And Google later learned how to think bigger. Coolblue sells something that many others sell as well, right? An iPhone or a MacBook or like a case for those products, a washing machine. So how do you make that interesting? Well, first of all, by being a specialist. So really know your stuff, have the most specifications, have the best salespeople, have help people make the best decision for them. But layering on top of that is sort of the art of the little big detail. So getting everything right from your first encounter on the website to the thank you page on the checkout experience, where we have a Spotify playlist with waiting music until your package arrives, order before midnight, get it the next day, even on a Sunday. And then the store employee in the store is helping you with your order. You need to get everything right, because if that store employee is having a bad day, then that's your experience of Coolblue. So there I learned getting those details right and being obsessed about all of them and going the extra mile. And then Google, of course, you can't really do that because you've got a product like Google Flights launched in more than 100 countries and needs to work for everyone. So how can you scale through a technological insight instead of just boots on the ground execution? And that's what I learned there. And I try to bring that together in Ahead by controlling as much of the experience as we can, but scaling as much as possible through partners, for instance, the existing healthcare infrastructure that's already quite well established in Europe, but layering on top of that the best possible experience and outcomes for our customers.
Very interesting. I mean, we'll talk We'll talk very soon about Ahead and introduce what you guys actually do. But I think this consumer-centric approach is probably very, very interesting. That background is probably a very, very good fit. One question I like to ask is oftentimes you observe people in, let's say, operating in the broader health space, health or wellness, preventative health space. You observe that there's oftentimes also great, let's say, founder market fit, because oftentimes maybe founders experience something that triggers them to really want to pursue, let's say, this mission of building something in the health space. Was there any personal, let's say, experience that triggered you to say, hey, I should do something in the preventative care space?
Yes and no. So for me, it started somewhere differently. So after Google, I thought I wanted to be an investor. And about a year into it, I thought, this is very boring. I need to build stuff again. And then I was talking to a really good friend of mine who's also building in healthcare. And he convinced me, hey, your skills could apply to this space because horrible products, horrible experiences, horrible technology, horrible outcomes. We can do something here. And that's how we got started with Everyman. Jon, you interviewed recently. So we started that team and then shaped the product, shaped the experience, shaped the technology. And now Jon and his team are taking it on a great ride. That got me so excited that I thought I should build full-time in healthcare. Right about the same time, there was some trigger to get me into preventative specifically. And it was the uncle of my nephews got diagnosed with a very rare form of brain cancer at 32 and with just one little kid, 1 year old. And that really triggered me to get, for instance, scan myself, get a full body MRI scan somewhere here in Zurich, get a blood test, get other tests done. And I saw how bad that experience was. Multiple visits, quite a lot of money I had to pay, bad websites. And then I got a report, a 5-page PDF, hardly readable. And there was actually a finding, a small aneurysm in my brain, but nobody called me about it. Nobody explained what it was and that I didn't have to worry. And that whole experience was one of the biggest trigger points to look more into preventive health. And then Ahead was shapen over time as it is today.
Thank you very much for sharing that story. Usually I ask, hey, what gap did you identify in the market? But I assume that was pretty much the gap where you realized, hey, I need to do something in that space. You mentioned it already. You were actually co-founding investor of Everyman Health with Jon, who I interviewed. I had the pleasure to talk to. Amazing guy.
He's great.
And so then you realize, hey, this space is really exciting. I need to do something in that space. You're not on this journey alone at Health. You already build a team. Could you maybe walk us through who's part of your team, co-founders, or let's say early investors or people who are part of your entrepreneurial journey before talking about the product itself?
That was probably the hardest part of this whole journey, getting the team, the band together. So they looked into prevention, talked to so many people across Europe. In the end, got connected to Dr. Donati, Olivio, and Dr. Fisher, and we really hit it off. And we at one point decided, yes, let's go and build something around this. And then I started talking to a bunch of VCs, and those VCs, as you've talked to a lot of founders, can be either believers or non-believers. And there are many in the consumer healthcare in Europe that are non-believers. So you talk to a lot of people. And one of those people said to me, super interesting idea. I've heard this before last week. You should meet Sven. Sven is working on something similar, but in Munich. And we met and then met a couple of times and met more times in Zurich and Munich, hit it off, did the whole, I'm not sure if you know, first round 50 questions for co-founders lists, went through all of them to really pressure test, can we work out together? And then we had a team together. And Sven is a PhD in MRI from Oxford, so he brings that specialism. Then we have the two radiologists. And later we found Dennis, our COO, founding COO, and also our CTO, late joining co-founder Vega. I worked with him in Google Shopping. He brings the AI and the engineering muscle. And then we've now expanded the cast of characters with a couple of other people like Jana, our marketeer, a designer, multiple engineers. So it's starting to take shape. But man, that first couple of months is the hardest, right? And it's just an idea and you get other people excited about. That's the -1 to 0 journey, I guess.
Yeah, very, very interesting. I assume it's not an easy thing to do. Let's start talking more about, let's say, the core product offering of Ahead Health. How does it work? Maybe walk us through the Ahead user experience, right? Maybe from booking a scan to receiving your MRI and biomarker results to walking away with a personalized health action plan. Yeah, bring us along how that looks so everybody, knows what we're talking about.
Yeah, absolutely. In the future, I hope this is a thing that lives in your pocket, that is always with you, that knows you intimately from all the conversations we had with you, all the data that we have on file in a very secure way from your previous tests, from whatever data that you want to upload, wearables, whatever, that's all in our app. Today, our experience is you go to our website. Maybe you've seen us on YouTube or on Meta or Google or have recommended this from a friend, which we happily get more and more of. And then you book your scan, 3-click experience. You pick a date, then you go to one of our partner clinics. For instance, here's London, here in Zurich, which is a private hospital group. You go to the desk on the day of the scan after getting our instruction mail, where we, for instance, tell you maybe do a fast 4 hours before your blood test, so we have accurate readings. Then you do the scan, which takes about 35 minutes, 5-minute blood draw, some paperwork, getting in and out of clothes. The scan is loud, but relatively comfortable, I've been told, not by laying myself into an MRI scanner for probably 5 hours by now, but especially also through all the customer conversations I had. You can pick your music if you want to. Then you go home. And then in about 3 to 5 business days, you get your report. Of course, if there are urgent findings, then we'll call you earlier about it. But in many cases, that 5 days is the right time to be able to process all the data, to create a report for you that explains everything that we've learned. So the biomarkers that we uncovered, the images that we've analyzed, the measures that we made on things like liver fat to brain age. And then you get this in your mailbox. You can click through it. And then based on the doctor's notes, for instance, that are in that report, you can say, hey, I think I want a follow-up call. And you can book a video call with one of our doctors to go deeper. And then the next steps start. So especially in the next versions of the app that we're currently building, there's going to be a whole lot more on a super actionable action plan. We want to go way further than just work out more and eat healthier, right? What can we learn from this super high detailed data set and translate that into the most specific actions for you?
On your website, I mean, obviously AI is a huge buzzword right now. It's everywhere. And on your website, you also proclaim that you're implementing advanced AI in several ways in your product offering. Could you maybe explain how and where AI is currently implemented in your business, or where it's supposed to be implemented soon?
Customers don't care about AI. Some do, most don't. Customers want that a really experienced doctor looks very carefully at their data and tells them if there's something wrong, and if so, what they need to do. And if nothing's wrong, many cases, how can I optimize? How can I go even longer, better? And that's the core insight I always need to explain first. So AI is a great technology, like many other technologies that we're also employing, to make that data to insight translation better, to make diagnosis over time more accurate, to be able to incorporate many more forms of data and then over longer time. And then, of course, the CPU can process so much more data than a doctor can. So that's how I view this. In the end, I think the AI will drop off many websites, both in healthcare and across the world, right? It's not the thing that people buy. Where do we use it today? Multiple places. So I think most importantly, it's in the integration of the data. So we get from our partner clinic the images. So thousands and thousands of DICOM files on the whole scan that we made of your body. We get a clinical report from the radiologist. So based on the data that we have, is there an aneurysm in your brain like I was discovered with, or an endometriosis diagnosis, or at least an indication of it? And then thirdly, we get our blood lab from the partner that we have for blood tests. Then we integrate that into a new report, and that report tries to uncover patterns in both the individual biomarkers, extracts, for instance, measurements out of the images, and then translates it into a layperson's language so that you can actually understand it, visualizes it, and then brings it to a doctor for review. Again, it's not about the AI in the end. It's about a doctor actually looking at the whole integrated report and saying, this is what you should do next. Integration layer 1. Second is a bit early in the process. So on the image acquisition, we use existing hardware. We're not building our own MRI scanners. We're using existing MRI software. Siemens, for instance, has their own suite. Before you have a new CE-approved, fully regulated diagnostic tools, you're like 5 to 10 years out. That's not what we focus on. We do build a custom MRI scanning protocol that sort of optimizes everything we could optimize in the existing hardware and software. So the latest AI features, working together with Siemens, together with my PhD MRI in radiologists to create this protocol. So that's the second thing. And the third, and that's where I think I'm most excited about on the medium to long term, is the sort of action model. Can we help people take the next step? This is the insight. There are many different scientific articles about this. This is what you can do next. Can be super precise on my back muscle being a bit bigger on the one side than on the other. Maybe you should work out more on this side to stabilize that and get rid of your lower back pain. It could be something like the actual diagnosis of lung cancer that we found, a metastasized one that the patient wanted to get screened after their earlier cancer surviving experience, but the GP didn't want to prescribe it. They went to us and we could help them uncover it. That's where I hope more and more will be, especially as we have this multimodal longitudinal data.
Very interesting. It's very interesting actually to also get a sense. I mean, I assume, let's say, those hardware manufacturers that have been building MRI for years, but also AI is having sort of an impact to make the technology a lot more accessible, affordable. There's been probably a lot of progress there. Is there anything you could share, let's say, more broadly about the MRI technology that, is there any innovation that is, reshaping, let's say, accessibility and affordability for all of us more generally as well?
In the end, it's a big magnet, and a magnet heats up your body if you do too many slices too quickly together. Originally, when I got into this, I got very excited. Can we build a 5-minute full body protocol? It's sort of obvious insight, old hardware, new software, just speed it up. Great. That physically won't work. There are some really interesting things being built. There's a company called QBio, for instance, working on a quantitative MRI scanner where they are even thinking about potentially not having to be in a tube, but just sitting in it and just a plug, and you don't need all the other fancy renewables that need to go into it. There are very interesting portable MRI scanners where my co-founder worked on before in a tech startup. I think the immediate next 2 years will be a lot on the improving, not even the diagnostic models, but the diagnostic AI UX. I've spent quite a bit of time next to radiologists. I'm not sure if you have. And then you see that the current state of things is you look at an image, then you right click on something, you go to the AI tool, then you start that AI tool. The AI tool starts on a different screen, takes like 20 seconds to load. Then you click on lungs, and then the lungs load another 20 seconds. And then it shows all kinds of nodules that are all not relevant. And that's not an improvement of the workflow for that radiologist, right? If you have an experienced radiologist, in maybe 10 seconds, they have assessed that there's no lung cancer there. So what can we do differently there? Can we pre-process? Can we say, this is clearly nothing? So you don't even have to, you can look at them first in a just go through them, and then look at the more interesting cases where we can already flag the things that you should look at. That's where I think the earliest start will be, earlier than these super optimized 5-minute protocols, which I do hope in maybe 5 to 10 years we'll get to. Because especially if you have scanned someone before, if you know more and more and more about this customer or this patient, you can hyper optimize the protocol, right? You have a different body than mine. Maybe I've already been an MRI scanner, so I can look at other things than I would look at your body. So we can maybe get it down from 30 minutes to 20 minutes to 50 minutes. 5 minutes, we'll take away.
Was very ambitious. What would you say, maybe also for listeners that are wondering, I mean, the MRI, let's say, based preventative screening is at the core of your product offering. Could you also just quickly outline what differences or advantages does the MRI-based screening actually offer, maybe in comparison to other imaging or testing models for you to, let's say, get a better picture of your overall health?
That's a great question. I think it's important to say I don't see us as an MRI company. In the end, we want to integrate many forms of data. We're thinking from genetics to skin cancer, from blood tests to, for instance, the DEXA scan that we do. There's a whole bunch of data that we want to integrate. I am very excited about MRI because it is very safe. There's no radiation involved. There's no contrast fluid involved, while giving you a lot of very detailed pictures of the insides of your body. It's not great at things like colon cancer, but it is really good at detecting, for instance, aneurysms in your brain. It is really good in doing hyper precise measurements on body composition, which is interesting for your longevity plan, for instance. And I think, especially if you combine it with blood, and especially if you go further and further in optimizing a personalized protocol. So, of course, for prostates, we already do something else than for ovaries, right? So there is already some personalization based on gender at birth, but there's so much more possible. I think then in 35 minutes plus 5 minutes is 45 minutes. You get so much more data than if you do this sort of checkbox standardized exercise that you do in many longevity clinics that I see, where even a 35-year-old CrossFit healthy person needs to do a grip strength test to have some kind of indication on whatever, while we know that that person does 10 pull-ups, right? It's not an issue. So I think on imaging going deeper into the body, you get more urgent signals on early detection of real diseases that can be really harmful and therefore can be really beneficial to detect earlier. And that's why I'm so excited as our starting point with MRI, but it's definitely not where I want to end. There's so much more on our roadmap to test.
Interesting. We'll talk about the roadmap later, but sounds exciting that you guys are, having a big vision ahead for you guys. Let's maybe do a little deep dive on, let's say, more or less your philosophy and your outlook on the industry, the overlook of the overall industry. So you say you want to bring preventative healthcare of the top 0.1% to the rest of us. What excites you most about the future of preventative care, from also maybe uniquely from the view of Head Health?
There's this statement, the future is already here, just not equally distributed. If you go to San Francisco or New York, you can pay $200K per year for this ultra premium conscious doctor who has a sit-down conversation with you, does ultimate tests from MRI, but you can do 2-3 tests flying to different top hospitals in the US. Then you get the follow-up care that you feel that you deserve because you paid a lot. Hyper-personalized, always on. You can text them on an app. It's already there. It's not AI, it's not democratized, but it's already there. How can I make some version of that available to many, 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 many more people here in Europe? That requires a long roadmap, as we just talked about. Because MRI is still quite expensive, right? 2,500 francs, probably a bit under 1,700 or so in the rest of Europe. I do believe that you need to start in a self-pay market with a sort of Tesla Roadster, a more expensive version of the product that you eventually want to end up with, but always with this mindset of how can I make this scale? We talked a bit about what I learned at Google. Everything needs to be set up in a way that it can scale to thousands, 10,000s, 100,000s. And that means I'm constantly thinking about, sure, I want to be an A brand. A hat needs to be quality. It needs to be trusted, but it doesn't and shouldn't be a premium brand. It shouldn't be just for the happy few. How can we automate some of the interactions? How can we, in a more cheaper, because less doctor hours way, create this very extensive report? Can we find tests that are cheaper, that can be good entry points? Can we already help people by just looking at their blood lab reports? So I'm very excited about finding all kinds of entry points, but then the ultimate sort of payoff or the sort of milestone to hit, healthcare is mostly paid for by other people. It's mostly paid for by insurances or the state or maybe your employer. So I'm super excited about over the next years proving that this actually works, that this is a benefit not just for your quality of life and for your longevity, but also for the amount of money that we invest in a system. And if we can hit that, yeah, then this can be a very big thing.
I like the answer. One thing I like, which was quite interesting, was your analogy with Tesla. I just listened to an interview with, I think it was the Eat Sleep founder, and he was, I think, asked the same question, whether his product is currently a premium brand. And he also offered the same analogy that, eventually they want to bring the price down and make it sort of a, let's say, standard offering. But obviously you will be able to maybe offer even better products. But the goal is to make their product accessible, right? That's maybe one critique maybe of the entire, let's say, health and wellness space, that it's only, catered to the very, very, affluent people, but it's leaving behind, a lot more people. But that's apparently changing.
I think it's valid criticism. I looked at so many ways to try and get into this space. Can you make it B2B? Right? It's can I sell to existing clinics, existing doctors? But then you run into the problem that the incentives aren't really set up that way, and there's a lot of skepticism in the existing healthcare system. I thought about maybe insurances, but man, is that hard to get into. I thought about states, but yeah, you have to bring the proof points and you need to do a lot of science to get there. So you need to get started somewhere. And for me, that's this place. I would have loved to be able to scale it to everyone from day one, but I think well, as a startup, I need my path there.
Absolutely. Absolutely. I mean, we're also mentioning now tons of terms. One question I love asking is, we mentioned now preventative care, preventative health, wellness, longevity. There's so many terms flying around this entire space. How would you differentiate yourself and define what you guys do at Ahead Health? Is it preventative health, or what do you guys do to best convey to maybe customers, let's say, your product?
Yep. Personalized preventative health. That's what I'm aiming for. And probably today, our first product is really early detection. I think longevity is super interesting, but still quite niche. And I think longevity, especially over the last years, has become such a maybe loaded term with so many different meanings. For one, it's like red light therapy. For someone, it's supplements. For some people, it is early detection. Maybe it's everything, but it's a space I don't feel fully at home in yet. So for me, it's really about medical, scientific backed early detection. I'm building a medical advisory board with people that are skeptics themselves, for skeptics by skeptics. That's one of the things that I constantly have in my mind. And I want to work with the best partners possible, like great hospitals that are renowned, medical specialists that want to refer into us and want to be referred to. I want to be part of the local medical system. And that is, I think, the ultimate way in the end to scale, but it's not easy because it means you're in a regulated space. It means that a lot of people are looking over your shoulder. You need to have a lot of grit to talk to a lot of naysayers. But I do think that's our sweet spot. Personalized preventative health.
Great. How do you address, let's say, given the potential of over screenings, how do you address this topic? Because, oftentimes you have to balance it out, do you, in between early detection and avoiding, let's say, unnecessary alarms, those two sides, how do you balance those two sides? Because there could also be false positives, etc. That's maybe one thing that is, maybe criticized about too much detection and too much using of MRI screenings, too much screenings. How do you address that topic?
It's a very valid question, and something I spent a lot of time thinking about. I think there's the medical professor I talked to who framed it. There's no such thing as overdiagnosis. There's over-treatment. I think it's not 100% true, but it's directionally correct. And I think it's very important. I'm a sort of engineer by training, and you have a whole lot of data coming out into your system, and there's all these alarm bells that can go off. And if the alarm bell goes off too many times, then you tweak the thresholds on that alarm bell. You're not just not getting the data in anymore, right? So I think it's very important that that's the basic principle and philosophy. You want to allow people to get the data that is about themselves, about their own body, and then help people make the best possible assessment on it. So how do you prevent false positives? So first of all, I think it's in general a lot smaller problem that a lot of medical professionals say it is. So if you look at the skilled players in the US, some of the scientific articles on screening in general and MRI screening specifically, MRI has come a long way. Radiology has come a long way. Technology has come a long way. So many of the follow-ups aren't immediately a biopsy or something risky. It's another image or maybe an image with contrast that you take. And you can learn so much already from that. And that's something I see already with the customers that we've scanned so far. We found real things, and we can talk about that more if you want in a second. We also seen a lot of stuff like my aneurysm, where a confident doctor can tell me, based on the science, based on the measurements, this is not something to worry about. It is a good picture to have, though. Come back in 3 years, and then we scan it again. If it has grown, then maybe it's something to start thinking about more. And that goes into maybe the second topic. For me, this is a lot about longitudinal data as well. Don't track just one point, but track multiple points over time. And then, of course, thirdly, multimodal. If you have both blood marker, image, maybe other data that we have, risk questionnaires, personal history, family history, the more we know about you, the better the diagnosis can be. So that's how I look at it. And then we can talk about the data, but at scale, it's like 0.8% or so of everyone. And that's quite a old data set even, gets what later is determined as an unnecessary biopsy. I think that's a relatively small price to pay for the up to 5 or 6% of people that get an earlier diagnosis of something and therefore have a longer, healthier life potentially. So that's how I make the trade-off. It doesn't mean we sit still, right? Every day, every month, we hope to get better at this and hope as an industry that you get better at this. But that's how I look at it.
Thanks for sharing those two perspectives, right? Makes total sense. Let's talk a bit about, let's say, go-to-market strategy as a whole. I mean, could you maybe give us an introduction into your, let's say, overall distribution strategy? You guys, as if I understand correctly, partner actually with clinics.
Yep.
Maybe also give us an introduction how you get users and the overall distribution strategy for you guys.
So we want to focus on the software, the integration, the experience, the great doctors that you can talk to, the insights, the network. That's where we want to play. Personalized preventative health. We think there are already a lot of blood test centers in Europe and a lot of MRI scanners. Many of them are not fully utilized. So we want to use partners for the data acquisition and have a sort of vetted partner network to help you find the one that actually is great. Because there's no trust pilot, right, for these clinics where you can say, okay, this has the highest data quality for an MRI scan, and I'll take that one. So that's one of the things that we will help you with. We currently have multiple clinics in Switzerland. We are looking at expanding that. We're looking at different modalities. I don't want to share too much yet, but I just hinted earlier in this conversation to some of the things that we're looking at. And we're looking at Germany as a next country. I think there are a couple of very interesting cities that could be next places for us. But frankly, I always felt you need to be awesome at one thing first before you go to try and be awesome at the next thing. And I think we're getting there, but I'm not. I think there's just a couple of things I still want to get right here in Switzerland before we make that step. How do we get customers? Increasingly, people refer people to us, which is great. So I have multiple husbands of wives that now get scanned, a personal trainer that was excited that brings us people. But frankly, most of them come through Google, Meta, the advertising that we start ramping up now. That's the sort of the starting point of our customer base. Increasingly, we will work with the GPs that do believe in prevention. They exist. Not a huge swath of people yet, but they are there. We want to work with other believers in longevity and prevention to refer into us. We are working with some great athletes. So for instance, there's a Dutch football player that's on our cap table that is a big ambassador for us. And there are some other things that we're cooking that I don't want to share too much about yet.
Great. You just mentioned your cap table. Is there anything you could also share in terms of, let's say, you mentioned it slightly, but if you've secured any funding or and also maybe what's your broad partnership strategy, right? I mean, something that we have realized is you have to work with clinics and tons of, let's say, stakeholders. What's your overall partnership strategy? And also, that also includes, let's say, funding, because your investors should be partners, right?
I agree. I agree. You know, some of our angel investors are the most helpful ones in our network for sure. Yes, we raise some money. As a founders, we put money in, and then we have a bunch of super useful, cool, smart people that are supporting us. From like the co-founder of Hugging Face, Cradle, people out of Google, My History, but also HealthTech founders, former GPs, lawyers. We try to find the people working backwards from what are the 4 or 5 biggest risks in building this, and then find the smartest people that could help us with it. And then apart from some angels, we have some from smaller VCs that are supporting us as well. And we have enough money now in the bank to at least start proving some stuff, and then I'm sure we'll need some more money later to go and make this bigger. Broad partnership strategy. I try to classify them in sort of 3 categories. You've got the clinics that are helping with data acquisition. You've got inbound and outbound. So inbound is, for instance, a personal trainer that is catering to a certain audience that wants, of course, early detection, but also these measurements to track over time, things like visceral fat and body composition. That's an inbound partner. And then there are a bunch of outbound partners that we work with. So if we find something, whether it is nutritionists, advice, whether it is a specialist to look at a specific female healthcare problems, we are building up a network of people that we see as partners for the next step after the discovery of whatever finding that we have.
Very interesting. I think those partners probably also contribute to educating their existing customers, probably maybe even about your product and what opportunities are back there, right?
Yes.
Because I assume that maybe lack of education might be sometimes something that people, maybe they have misconceptions or they're a bit, cautious because they hear MRI screening and they feel like, hey, that's maybe for sick people.
Yep.
So maybe that's something that it contributes
Oh,
to.
absolutely. And look, I'm always surprised when I talk to doctors. This is not just N is one. I've talked to multiple doctors who are outwardly very, very skeptical about prevention. But then if you ask them, what have you done yourself or what have you done for your mother? Then there's a whole bunch of stuff that they're not as skeptical about anymore, right? So this is understandable from their societal role, where, for instance, a GP has a role to play to be the first line in preventing overcrowding of the specialists that are behind them. So if that's your job for a large part of your day, then it's reasonable to be skeptical about, hey, there's this new company bringing in even more patients. So I think it's totally understandable, but we need to look over that horizon. And that's what we want to build.
Nick, what would you say has been the toughest challenge maybe for Ahead so far in building your business? Is it, regulation? Is it scaling? What is typically in this health tech space for you guys something that is particularly challenging?
What to build and what not to build. So there is no Shopify for healthcare or for preventative health. It's one of the reasons why I'm excited about this, right? Just like when I was building Coolblue, an e-commerce company, and there was no Shopify, we had to have like 400 engineers to build the software to deliver the experience. So that's what I'm excited about. But especially as a very early stage startup, then you look at a patient information system that's sort of regulatorily important to have but it's a Swiss niche thing that you need it doesn't have a developer page or APIs that has all these features that you don't need. It's okay. Do we need to build our own patient information system or should we build this integration layer, or should we focus on this diagnostic tool, or how do we do, there's just so much to build because you need to deliver the whole experience as the start of the conversation, right? If you want to have an end-to-end thing with all the little big details and all of them right, you need a lot of control over that, and software is needed. So what to build yourself? How full stack do we really need to be? I think that's the toughest challenge in my weekly schedule, I would say.
Interesting. Maybe one question I also like to ask is what's maybe a major misconception that outsiders have of Ahead Health? Let it be customers or just, maybe friends of yours personally or investors. What is a major misconception they have about you guys?
I think I already said it before, but it is true that we're an MRI company. I don't think it's weird that people think that way, right? Because if you go to our website, it says MRI. But I can't wait to expand this story and show all the other things that we're working on and we want to build over the next 5, 10, 20 years. There's so much on a roadmap that I get excited about, and MRI is just the beginning. So I think that's the biggest misconception, which is completely understandable, but high on my list to prick the bubble on, pop the bubble.
There is there something? I mean, that would have been the next question related to your roadmap. I mean, I like first of all that you're looking, let's say 5, 10, 20 years ahead. So you really, or you guys are really intending to build a long-term sustainable company out of this. Is there something you could share, or maybe ideas where this could go? You know, because at the end of the day, you want to, let's say, bring preventative care to, let's say, all of us, right? I assume that is the ultimate vision. Maybe share a bit about your roadmap in the next months, years, where you guys are heading.
I want to help at least 1 million customers have access to proactive, personalized preventive healthcare, and begins with the currently top 0.1%, I guess, with this 100,000, 200,000 new UR concierge doctor. Let's first bring it to the top 1%, top 15, top 30, and hopefully then to everyone. And that everyone requires insurances and state and scientific proof of this as a category. So roadmap wise, I'm most importantly super excited over the next months to help a lot of customers find things they otherwise wouldn't have found, and for all the healthy people to give them actual insights for a longer, healthier life. So that's top of my list. Delivering a great experience every week, every day. So that's most importantly. Then secondly, high on my list is adding additional testing modalities. So we are already working on a calcium scoring. We're working on Mama MRI. We're working on DEXA scan. There's a whole bunch of other stuff that we have in the mix. And if I just keep it about the short 3-month roadmap, then the other thing I would point out is the next steps on your action plan. So we have these actions for you. How can you action them in your life? How can we make people come back to our app, talk again to our doctor? How can we help them actually get to a better outcome? Because it's nice to have data, it's nice to have insights, it's nice to present those in a nice way, but ultimately it's about what do you do with that? And I'd love to play a role in that part over the next months. And then later, with all kinds of other cool things that we're building.
Very exciting. Nick, we're closely coming to an end. I find it very exciting, your view. I mean, you've experienced, let's say, the e-commerce wave, right? I mean, if you would have asked people, let's say 20 years ago that you could have get your products delivered in this manner, which is usual today, people would have, said you're crazy. And this is nowadays sort of, almost commoditized. Everybody can order something in a convenient way. Sort of envisioning that this could happen to health eventually is very, very inspiring and very interesting. So there seems to be a lot of tailwind, and hopefully we get there someday. Maybe before ending this podcast, is there anything you would like to share to the audience that you feel like is worth sharing? Anything you feel like you would like to share?
Come over to healthcare. Come build with me, come build your own startup, come build in one of the many, many cool scale-ups out there in Europe. The water is warm. It's not for the faint of heart. It is messy. It is high stakes with real people. It's regulations. It's like a lot of glass to crawl over. But the impact that you can deliver is so amazing. And I would love to see more people come over from big tech and tech startups. Sure, it's cool to build an AI coding assistant, but how many of those are there already? There's so much left to build here in HealthTech, and I hope more people come hit me up on LinkedIn or Twitter and join the cause.
Great. Thank you very much, Nick. Appreciate your time and wishing you all the best at your journey with Ahead Health.
Thanks a lot.
Bye.